So I think working with the midwives, especially around neonatal care, I think they're fantastic at the birthing parts of it, but care of the neonate after delivery was definitely an area that I felt I accomplished changes, especially with breastfeeding. Everybody assumes, oh, everybody breastfeeds in a developing country, they have trouble. Yes, they do have trouble, and a lot of the neonates were starving, they weren't gaining weight. So I think the breastfeeding, working with the neonates, educating the mothers and the carers on how to care for those babies, and also teaching them very simple things like feed the baby in the first hour. The colostrum's very important, don't throw it out, keep the baby skin to skin, keep the baby warm. I know that will make a difference to babies' outcomes, and I'm very proud of that. The other thing is wound care. There was a lot of issues around wound management, and it was just teaching the staff about the process of wound healing and what they needed to do and why it was important to do infection control and have good sterile equipment. And I think the third thing was about person-centred care. This is a new concept, and I was asked by the Secretary of Health in the department from Bougainville to really establish a culture of caring and person-centred care. So all the time I would talk about it's really important that we put the patient first and the family, rather than, it's not about the organisation, it's about the person. So I role modelled that, and I really fought very hard for that, and I was an advocate for that. And I'm proud about the work that I did around person-centred care. So be patient, be flexible, and just sit back for 2-3 months, watch, look, listen and learn.
And I think you have to be interactive with the community. You know, because it's all about interaction and having the ability to open yourself up to a different culture and different people.
I would definitely do it again. This is actually my second assignment. I did one in the 90s and I wanted to come back much earlier, but life is life, and it took me many years before I came back. So definitely both of us would do it again, because it's just such a wonderful experience, and I just love working in the developing countries. I like working with people that are so appreciative of any help that you can give them. I love the lifestyle and just all the different foods and cultures and learning a new language. We're just privileged really to be part of their life, even if it's just for 1 year. I think VSA is a good organisation in the fact that they focus on capacity building, and I think that's the philosophy that I took with me in the position that I did. And even though I couldn't capacity build as the job was initially set up, I made sure that I did capacity building, even if it was on a day-by-day basis, with a particular staff member at the bedside to make a difference for the patient.
Yes, because I would like to say, if it wasn't for the followers, we couldn't do these assignments, and I encourage people to keep volunteering and also donating money, yes, because it helps other people in other cultures to benefit from that. And thank you.
And to the government, keep the funding coming.
I mean, yeah.